Midnight chaos erupted in the emergency room. Ambulances arrived one after another, doctors ran between patients, and the entire hospital seemed to pulse with urgency. In the corner, the night security guard just watched quietly, until a doctor desperately called for help. The security guard moved immediately, but his movements weren't those of a civilian security officer. His fingers bore old battle scars, and on his arm was a partially visible tattoo. When the doctor looked closer at the tattoo, his breath caught. Purple Heart. This man wasn't just a security guard. St. Mary's General Hospital never slept, but the night shift was different. Quieter corridors, dimmer lights, and a skeleton crew holding down the fort until morning. Frank Henderson had been walking these halls for 15 years, every night from 11 p.m. to 7 a.m., badge 247, clipped to his navy blue uniform. Frank wasn't like the day shift security guards. He didn't joke around with the staff, didn't check his phone during rounds, and never complained about the hours. He was 52 years old, stood 6 feet 1 inch with graying hair and weathered hands that suggested he'd done more than just hospital security work in his lifetime. His routine was methodical. Emergency department at 11:30, ICU at midnight, pediatric ward at 12:30, surgical floor at 1, then back to the main desk. He carried a small notebook where he logged everything. Unusual sounds, maintenance issues, visitor violations. The hospital administration loved him. Reliable, professional, invisible. The nursing staff had mixed feelings about Frank. He was helpful when needed, but distant. He'd assist with aggressive patients, help move equipment, even stay late if emergencies ran over. But he never joined their conversations, never shared personal stories, and politely declined invitations to hospital social events. "He's like a ghost," said Maria Santos, an ICU nurse who'd worked nights for 8 years. Professional, but you get the feeling there's a lot more going on beneath the surface. Frank's personal life was equally private. He drove a 2010 Honda Civic with over 200,000 miles, lived in a small apartment 10 minutes from the hospital, and had no social media presence. The HR department had basic information: previous employment at various security companies, clean background check, emergency contact listed as none. But Frank carried something that none of his coworkers knew about. Every night, pinned inside his uniform shirt pocket, was a small metal object. Not visible, not mentioned, but always there. A Purple Heart medal, earned 28 years ago in a place most people couldn't pronounce. Tuesday, October 15th, started like any other night shift. Frank clocked in at 10:55 p.m., reviewed the day shift report, and began his first round. The emergency department was busy but manageable. Car accident, chest pain, a few walk-ins with flu symptoms. At 1:43 a.m., everything changed. The first ambulance brought in a motorcycle accident victim, multiple trauma, unconscious, bleeding heavily. Before the trauma team could stabilize him, 2 more ambulances arrived. Multi-vehicle collision on Highway 94. 4 critically injured patients incoming. Dr. Sarah Chen, the attending physician, had been working at St. Mary's for 3 years, but had never seen this level of simultaneous trauma. The emergency department, designed for one major case at a time, was about to be overwhelmed. "We need more hands," she called out to anyone listening. "Where's the night supervisor?" "Homesick," replied Tom Rodriguez, the charge nurse. "Day supervisor is 20 minutes out." Frank heard the commotion from his position near the main desk. Hospital policy was clear: security personnel were not medical staff. They could assist with crowd control, help move patients, but were not to involve themselves in medical procedures. But as Frank watched the controlled chaos unfold, something shifted inside him. The sounds, the urgency, the life and death decisions happening in real time. It triggered something he'd buried for decades. Patient 1, motorcycle rider, massive head trauma, blood pressure dropping. Patient 2, car driver, crushed legs, screaming in pain. Patient 3, passenger, internal bleeding, unconscious. Patient. 4. Child 8 years old, minor injuries but terrified, and crying for her mother. Dr. Chen was trying to coordinate care for all 4, while 2 residents and 3 nurses scrambled to keep up. The trauma rooms were full, equipment was running low, and more ambulances were en route. That's when Frank made a decision that would change everything. Frank approached Dr. Chen, who was attempting to intubate the motorcycle victim while simultaneously giving orders for the other patients. "Doctor," he said quietly, "I can help." Dr. Chen barely looked up. "Sir, I need you to clear the hallway and keep family members in the waiting area." "That's not what I mean," Frank said, stepping closer. "I have medical training." This time Dr. Chen did look up, confused and slightly irritated. "Security training doesn't qualify you to—" Frank rolled up his left sleeve. On his forearm, clear and unmistakable, was a tattoo of the Purple Heart medal. Below it, in faded black ink, 68W, Combat Medic. Dr. Chen's eyes widened. 68W was the military occupational specialty code for combat medics, the soldiers who provided emergency medical care on battlefields. "How long ago?" she asked quickly. "Iraq, 2003 to 2005. Afghanistan, 2007 to 2009. Trauma medicine, under fire." Dr. Chen made a split-second decision. Take patient 2, the leg crush injuries, stabilize for transport to OR. Frank moved with precision that surprised everyone watching. His hands, which had seemed ordinary moments before, worked with the confidence of someone who had done this under much worse conditions. He assessed circulation, started an IV, administered pain medication, and applied proper splinting to the damaged legs. "BP stabilizing," he called out, using medical terminology that made the nursing staff take notice. "Distal pulses present, no signs of compartment syndrome, ready for orthopedic consult." While Frank worked on patient 2, Dr. Chen managed to stabilize patient 1. The residents handled patients 3 and 4. Within 45 minutes, all 4 trauma victims were either in surgery or admitted to intensive care. As the emergency department returned to normal volume, Dr. Chen found Frank at the sink, washing blood from his hands with the methodical thoroughness of someone who had done this countless times. "We need to talk," she said. The hospital cafeteria was empty at 3 a.m., except for a few vending machines and fluorescent lights humming overhead. Frank and Dr. Chen sat across from each other with coffee that had been sitting too long. "Combat medic," Dr. Chen said. "That explains a lot." Frank nodded. 68 whiskey, attached to infantry units. My job was keeping soldiers alive long enough to get them to surgical teams. "What happened tonight? That wasn't basic first aid. You performed advanced trauma stabilization." "Muscle memory," Frank said quietly. "Some things you don't forget." Dr. Chen studied his face. "How many deployments?" 3. Iraq first, then Afghanistan twice. Total of 4 years in combat zones." "And the Purple Heart?" Frank was quiet for a long moment. IED explosion outside Fallujah. "November 2004. I was treating wounded Marines when the second device went off. Took shrapnel to the chest and left arm. Kept working until the medevac arrived." "How many soldiers did you treat?" "I don't keep count." "Estimate?" Frank stared at his coffee. "Couple hundred? Maybe more." "You don't really think about numbers when someone's bleeding out in front of you." Dr. Chen leaned forward. "Frank, with your experience, why are you working security? You could be working as a paramedic, emergency technician, even go back to school for nursing or physician assistant programs." Frank's expression darkened slightly. "It's complicated." "How so?" "When I came back from my last deployment, I had some adjustment issues, PTSD, anger problems, difficulty sleeping. I lost a couple of medical jobs because of it. Employers don't like hiring veterans with mental health histories. Dr. Chen felt a knot form in her stomach. That's illegal discrimination. Prove it. They just say you're not a good fit, or we found a better candidate. After a while, you stop trying. So you took security work? Security jobs don't ask too many questions about gaps in employment or why you left previous positions. Show up, do the job, go home. Simple. Frank paused, rolling up his sleeve again to show the Purple Heart tattoo more clearly. This tattoo isn't decoration. It represents the worst day of my life, but it also represents every life I helped save. Working here, walking these halls, it keeps me connected to that part of myself without the pressure of being responsible for life and death decisions every shift. Dr. Chen studied the tattoo more closely. The artwork was detailed, professional. Around the Purple Heart medal were small dates and initials. What do the initials mean? Frank's voice became very quiet. Soldiers who didn't make it home. Davis, Martinez, Johnson, Williams. Good men who died despite everything I did for them. Tell me about Fallujah, Dr. Chen said gently. Frank was quiet for several minutes. When he spoke, his voice carried the weight of memories he rarely shared. November 12, 2004. Second Battle of Fallujah. We were clearing houses, looking for insurgents. My unit, Alpha Company, 1st Battalion, 3rd Marines, had been taking casualties all week. He took a sip of cold coffee. That morning we got hit during a routine patrol. IED took out our lead vehicle. 4 Marines wounded, 2 critical. I was treating Corporal Martinez, sucking chest wound, massive blood loss. Had him stabilized and ready for evacuation when the second device went off. Frank unconsciously touched his left shoulder. Shrapnel tore through my body armor, punctured lung, fractured ribs, severed an artery in my arm, but Martinez was worse. The blast reopened his chest wound, and he was drowning in his own blood. Dr. Chen listened without interrupting. I had maybe 10 minutes before the bleeding killed me, but Martinez had less. So I kept working, sealed his chest, got him breathing, controlled the hemorrhage. By the time the corpsman reached us, I'd lost so much blood I couldn't stand. Did Martinez survive? Frank smiled sadly. He did. Recovered fully, went home to his family in Texas. Gets married next month, actually. Sends me updates sometimes. And you? Medevac to Germany, then Walter Reed Medical Center. 6 surgeries, 8 months of physical therapy. They offered me a medical discharge, but I chose to redeploy. Dr. Chen looked surprised. You went back? Afghanistan, 2007. Couldn't let my unit deploy without a medic. Did another 15-month tour, then one more in 2009. Why did you finally leave the military? Frank's expression grew darker. The last deployment broke something inside me. Too many young soldiers, too many preventable deaths. I started having panic attacks, couldn't sleep, couldn't trust my own judgment anymore. He paused. One night in Kandahar, I froze. A soldier was bleeding out from an RPG attack, and I just couldn't move. Another medic had to take over. That's when I knew I was done. What happened when you came home? Dr. Chen asked. Frank's hands tightened around his coffee cup. The VA diagnosed me with severe PTSD, depression, and anxiety disorder. Classic combat stress reaction. They put me on medications, enrolled me in therapy, the whole program. Did it help? Some. The nightmares became less frequent, the panic attacks more manageable. But the civilian world? It's different. People don't understand what combat does to you. Frank looked around the empty cafeteria. I tried working as a paramedic in Chicago. Great job, good pay, using my skills. But every time we responded to a trauma call, car accidents, gunshot wounds, anything with serious bleeding, I'd see Fallujah again. Martinez gasping for air, the sound of incoming mortars, the smell of blood and diesel fuel. You had flashbacks? Worse, I'd become so focused on the medical emergency that I'd forget where I was. One time, I started yelling military orders at other paramedics, treating a car accident like a combat situation. They thought I was having a breakdown. Dr. Chen winced. After that incident, my supervisor recommended I take medical leave. When I came back, they transferred me to administrative duties. Within 6 months, they found an excuse to let me go. The same thing happened at other medical jobs? Frank nodded. 3 different places. Emergency services, urgent care clinic, even a veterinary hospital. Every time, the same pattern. I'd perform well for a while, then something would trigger a PTSD episode and I'd be labeled unstable. So you switched to security work. Security is different. Quiet, predictable, low stress. I can help people without the life and death pressure that triggers my episodes. Most nights, nothing happens. Just me, walking empty hallways, making sure everything is safe. Frank paused. Until tonight. Dr. Chen leaned back in her chair. Frank, what you did tonight saved that patient's life. Your combat medic training, your experience under pressure, it's exactly what we needed. I know. So why hide it? Why work security when you could be using your medical skills? Frank was quiet for a long time. Because this job doesn't judge me. When I have a bad night, when the memories get too strong, I can still do my security rounds. But medical work, one mistake, one moment of panic, and someone dies. But you didn't panic tonight. Tonight was different, maybe because it reminded me of combat. My training took over, but I can't guarantee it would happen that way every time. Dr. Chen considered this. What if I told you there might be a way to use your medical skills without the pressure of emergency medicine? Frank looked up, interested. We have a patient care technician position opening up, working with stable patients, assisting nurses, basic medical procedures, nothing life-threatening, but using your medical background. Would I pass the background check? Your military service and medical training would actually be advantages. The position requires someone reliable, trustworthy, and calm under pressure. Sound familiar? Frank smiled slightly. I'd have to think about it. Take all the time you need, but Frank, tonight proved something important. You haven't lost your medical skills. You've just been using them in a different way. 2 weeks later, Dr. Chen was finishing her night shift when she saw Frank making his security rounds. But something was different. He was wearing scrubs under his security jacket. How's the new position working out? She asked. Frank smiled, the first genuine smile she'd seen from him. Good, really good. It's nice to be helping patients again without feeling like their lives depend on my every decision. Any regrets about leaving security? I'm still doing security part-time. Hospital let me split the role. Half security, half patient care. Best of both worlds. Dr. Chen noticed something else different about Frank. He seemed lighter, more engaged with the hospital staff. The nursing staff loves having you around, she said. Maria Santos told me you helped her manage a difficult patient yesterday. Psychiatric episode. Guy was having flashbacks from his own military service. I could relate to what he was going through. You talked him down? Sometimes it helps to know that someone else has been where you are, that you're not alone in dealing with invisible wounds. Dr. Chen realized something profound was happening. Frank wasn't just getting a new job. He was reclaiming a part of himself that trauma had stolen. Frank, can I ask you something? Sure. Do you still have nightmares about Fallujah? Frank considered the question. Sometimes, but now I also dream about the patients I help here. The positive memories are starting to balance out the traumatic ones. 3 months later, Frank Henderson was featured in the hospital newsletter as Employee of the Month. The article described his transition from security guard to patient care technician, his military service, and his dedication to helping others. But what the article didn't mention was the quiet revolution Frank had started. Other veterans began applying for positions at St. Mary's. The hospital developed a veteran hiring initiative. And slowly, the night shift at St. Mary's became known as the place where former soldiers could use their skills to heal, instead of just survive. Dr. Chen still works nights at St. Mary's General Hospital, and Frank Henderson still walks those halls, but now he carries stethoscope instead of just a security badge. His Purple Heart tattoo is no longer hidden. It's a badge of honor that reminds everyone that heroes don't always wear capes. Sometimes they wear scrubs and work the night shift, quietly saving lives one patient at a time. The last time Dr. Chen saw Frank, he was teaching a young nursing student how to start an IV on a difficult patient. His hands were steady, his voice calm, and his presence brought comfort to both the student and the patient. Some people think Purple Heart recipients are broken, Frank told the nursing student. But we're not broken. We're proof that you can survive the worst and still choose to help others. Frank never did go back to emergency medicine, but he found something better, a way to use his skills without the trauma, to help without the pressure, and to serve without the sacrifice. Because sometimes the greatest act of courage isn't charging into battle. Sometimes it's choosing to heal after the battle is over. Sometimes the most powerful stories hide behind the most ordinary jobs. Sometimes a security guard is really a hero, a Purple Heart recipient, a lifesaver who just needed someone to look close enough to see the truth. So I ask you, have you ever met someone like Frank? Someone whose quiet professionalism masked an extraordinary past? Someone who served with honor and never asked for recognition? Share their story in the comments. Tell us their name. Because here on the Veteran Chronicles, we believe every veteran's service deserves to be acknowledged. Thank you for watching. If this story moved you, subscribe and share it. Help us make sure that heroes like Frank Henderson are never invisible again. We'll see you in the next story. And until then, if you ever meet someone who works quietly, serves humbly, and never talks about their past, take a closer look. You might be standing next to a hero.